Okay, we're going to go through just cleaning, how to clean dentures. So this one is a full denture. Pop it out of the patient's mouth. Do this twice a day. Check the mouth for any pouchings. Quite often patients will tend to pouch food around the cheeks. It's a good idea just to either a little bit of gauze or a little brush just to make sure that there's no food debris in the mouth. It's always a good idea as well to just give the tongue a bit of a scrape as well. But going back to the denture, so the dentures usually are like this. You want to really focus on cleaning the palate. These little brushes are quite nice. These are denture brushes. If you don't have a denture brush, a scrubbing brush will do just as well. Give it a really good scrub in there. That's what we want to do. We want to scrub the palate, give it a firm grip, because if you slip it, if it slips, they're likely to fracture, especially in the sink. Also give the teeth a good clean around the edges and on the insides as well. So really good clean with that. Bit of soap and water, you don't need to use toothpaste, and then a rinse under the tap, and then either pop it back in the patient's mouth if it's in the day, or they can just soak it in a solution of Milton's or Steradent a couple of times a week, or failing that, just plain water at night. Make sure they take it out, leave it out at night. That's really important. You may come across partial dentures, something like this. This particular one is a metal one. Again, with the partial denture, just the same idea. Give it a good scrub, but make sure that you're paying particular attention to these little metal bits, because they clip onto the teeth. If there's plaque there, it can cause tooth decay on the natural teeth. So really important to give those a clean. And one more thing you may see is a partial denture. This is quite a small denture, but this has got clasps, and it's the clasps that are really important. So you can take the little small end of that brush and give it a good clean around like that. Make sure you're cleaning the clasps before you pop it back in the mouth. So these kits, these are Fixodent. They're produced or distributed, I should say, by Oral-B, and if you contact Oral-B, you may be lucky enough that they may send you some. I also just want to show you a little bit of Fixodent. Some of your clients will be using Fixodent or glue, Polygrip, those kind of things to secure their denture in place. And the way to apply this is just literally a few little drops here, here, here. Not a big layer of it. You don't need massive amounts. So that's probably enough just to go around the inside there. You don't have to worry too much about the palate. It's more the ridge around there, like so. And then just pop it back in the mouth, hold it for a couple of seconds, and that should be enough to secure it for the rest of the day. Okay, hope that's been helpful.